Irritable bowel syndrome, or IBS, affects between 25 and 45 million people in the United States, and it's the second most common cause of missed work each year. Now, if you've been struggling with IBS, let's take care of that right now. I'm Julie. I'm a nurse practitioner and functional medicine provider. So what exactly is IBS? IBS stands for Irritable Bowel Syndrome. Now, this is a common functional gastrointestinal disorder. It is characterized by a group of symptoms including abdominal pain, bloating, gas, and changes in bowel habits, things like diarrhea, constipation, or both. In fact, there are 3 different types of IBS. The first one is IBS-D. This is IBS type with diarrhea. Second is IBS-C. This is IBS with constipation. And then there is IBS-M, and this is a mixed picture of both constipation and diarrhea alternating. Some other symptoms that can occur with IBS include urgency, a strong, sudden urge to have a bowel movement, mucus in the stool. Some individuals may notice an increased presence of mucus in their stool. Incomplete evacuation, the sensation that a bowel movement is incomplete even after going to the bathroom. Changes in stool appearance that may be in color, consistency, or shape. IBS is also associated with fatigue, which can be due to chronic discomfort and disturbed sleep patterns. And finally, many people with IBS experience heightened levels of anxiety and depression. There is a known connection between the gut and the brain, and it's something called the gut-brain axis. Now, IBS is typically diagnosed based on a clinical assessment of these symptoms and the exclusion of other medical conditions that could be causing similar symptoms. The goal is to uncover the root cause of the symptom in order to heal the body. In terms of root causes, many patients who suffer from IBS may have underlying dysbiosis. This is an imbalance in good and bad bacteria in the gut. SIBO, or small intestinal bacterial overgrowth, may be the underlying cause. And another underlying cause may simply be food sensitivities. A little bit more about diagnosing IBS. This starts with a thorough medical history, and again, it is primarily diagnosed by symptoms. But we can't just stop there. It is very important to get to the root cause of these symptoms. This may include your practitioner ordering a stool test to assess for dysbiosis, or a SIBO breath test to rule out small intestinal bacterial overgrowth, or even a food sensitivity test. Now, all of these tests can be ordered through Rupa Health. Treatment for IBS is based on identifying the underlying or root cause, but it often involves a combination of dietary and lifestyle changes, possible supplementation, and also stress management techniques. A few things to consider when treating IBS. Start by identifying and avoiding foods that trigger your IBS. Common triggers include high FODMAP foods. These are certain types of carbohydrates that can ferment in the gut and lead to symptoms. Keeping a food diary can be very helpful in identifying your specific food triggers. If these carbohydrates seem to be an issue, consider trying a low FODMAP diet, which restricts these foods to reduce symptoms. Now, you can learn more about this type of diet by visiting rupahealth.com and subscribing to the magazine. Increase your intake in soluble fiber. This can help to regulate bowel movements and reduce diarrhea. Now, some good sources of soluble fiber include oats, psyllium husk, and certain fruits and vegetables. Probiotics are beneficial bacteria that can help to balance your gut microbiome. Some people with IBS find relief with certain probiotics, but effectiveness can certainly vary. Make sure that you are working with a healthcare provider to determine what probiotic is best for you. Staying well hydrated is certainly essential for maintaining healthy bowel function. Making sure that you are drinking at least half your body weight in ounces of water a day is a great goal. Practicing mindful eating by taking your time, chewing your food thoroughly, and eating in a relaxed environment. Rushed eating can lead to swallowing excess air and can exacerbate symptoms. Try to eat meals at regular times each day to help regulate your digestive system. Now, some people will also find that eating smaller, more frequent meals throughout the day can help to reduce symptoms by avoiding overloading the digestive system with a large meal. As I mentioned, stress can exacerbate IBS symptoms. Work on engaging in stress reduction techniques like meditation, yoga, deep breathing exercises, and regular physical activity. Both caffeine and alcohol can irritate the digestive tract, so consider limiting or avoiding these. For some individuals, gluten and lactose can be triggers. Experiment with eliminating or reducing these components in your diet to see if that makes a difference. Avoiding artificial sweeteners. Now, there are some artificial sweeteners like sorbitol and mannitol that contribute to IBS symptoms. Make sure you're checking your labels for these ingredients. Now moving on to some supplements that can be helpful for IBS symptoms. Peppermint essential oil. Enteric-coated peppermint oil capsules can help to relax the muscles in the gastrointestinal tract and reduce abdominal pain and discomfort. Artichoke leaf extract. There are some studies that suggest that artichoke leaf extract can be beneficial in managing IBS symptoms, especially when it comes to bloating and gas. Turmeric has anti-inflammatory properties and can help to reduce IBS-related inflammation and abdominal pain. Ginger supplements have anti-inflammatory and digestive benefits. They can help with nausea, bloating, cramping. Marshmallow root may provide some relief for IBS symptoms, such as soothing irritation and inflammation in the digestive tract. Some people find that magnesium is helpful, especially if they have IBS with constipation. And finally, digestive enzyme supplements can help with breaking down the food and extracting nutrients from the food. This also helps reduce symptoms like gas and bloating. If you want more videos like this on root cause medicine, be sure to like and subscribe to our channel.